All right, welcome everyone to our monthly Moving with MS virtual support group. As you know, this is a support group that I absolutely love presenting to every month, just because each month we have a different topic that is in some way, shape, or form physical therapy related for specifically people with multiple sclerosis. Let's go ahead and dive in. And actually, before I share my first slide, I do just want to ask you guys who are on to communicate in the chat box. Have you felt or noticed any type of pain or sensory change that you feel may have been related to multiple sclerosis at any point in your MS diagnosis? Maybe you're in pain right now, or you have sensory changes right now. Maybe it's consistent, it's always there. Maybe you've had it once, but it went away. I'm just curious. So type yes if you feel that yes, at some point you have had pain or sensory changes, and then no if you feel like you have not had any type of sensory or pain. I partner with MS Views and News to bring you this Moving with MS virtual support group, and our supporter is Viatris. So a huge thank you to both of them. All right, so I'm seeing Elizabeth says yes, 10 plus years of paresthesias. Veronica, Susan, Kathy, I'll say yes. Paula says yes, falling and a tightening in my neck. So that might be slightly different. We'll come back to that, but pain due to a fall or something orthopedic is going to be different than the type of pain and sensory changes specifically caused from MS. Samantha says yes. Barbara says yes. But my doctor says it's arthritis. Yeah, so that's another example of, there's different reasons for pain, orthopedic reasons like a fall, arthritis, an injury might be different than MS-related pain. Not that it doesn't validate the pain that you're feeling at all, it's just a different cause. Excuse me. Felicia says yes. Lori says bladder urgency is what led to my diagnosis. Urologist figured that out. Julio says yes. Lori, yes to her own MS Views and News. Barbara says yes, mostly in my legs. Dion says yes, I recently experienced some quad pain in my weak leg. Kanita is unsure. Pam says no pain or sensory. Awesome. And Lori also says no, I don't have MS pain. Paula says I don't have feeling in my legs. Okay, so that's more of a sensory change. But in walking, often my limbs just fall or disappear. Yeah, okay. All right, thank you for letting me know where you guys are at with that. Okay, so again, we're touching on pain and sensation. I'm Gretchen Hawley, if you forgot my name already. All right, so I wanted to touch first on a few stats related to pain and multiple sclerosis. And again, today's topic, we're really focusing on MS-related pain and sensory changes versus orthopedic. However, it is possible to have both. You can have orthopedic related pain from, say, arthritis or a fall or some type of injury, and MS related pain. And we'll get into how they're different and why. But 2/3 of people with MS have some level of pain, which is a lot of people, and over half are affected by chronic pain at some point in their MS journey. And we'll get into what's chronic versus what is acute, which is the opposite. So types of pain. So acute pain is more the type of pain that is sudden and inconsistent, and it's typically caused by an injury, surgery, illness, trauma, etc. So acute pain would be like if you fell and you hurt your hip. That hip pain would occur for anywhere from a few hours, a few days, a few weeks, but it does go away. Whereas chronic pain is more consistent and long lasting. It can be caused and or worsened by stress and anxiety. But I do want to note here, sometimes it is a mix of both. So chronic pain, because it means that it lasts longer, could mean that it's not necessarily from MS, it's from arthritis. Arthritis typically doesn't go away. So even though arthritis might be thought of as more of an acute pain. It's actually more of a chronic pain because it is long lasting. It does stay there. So there is a little bit of overlap, but generally speaking, if someone is asking you, is your pain acute or chronic? Generally what they're asking is, does it come and go, or is it there all the time? Give or take. So that's typically what we're looking for. And one reason for that and why it's important is because they are treated a bit different. And as you can see, for chronic pain, sometimes it can be worsened by stress and/or anxiety. We are going to get into treatment in a bit here, but some of the treatments are more stress and anxiety related, since that can cause worsening and even cause the pain to be provoked. Lori says, always look forward to your bright outlook. Could never forget your name. Awesome. Samantha says, I have phantom pain in my feet. Yeah, so phantom is more of a sensation, which is good to know. Charlie horse used to happen right before I discovered magnesium. Yeah. So types of pain and sensations. So, oops. Didn't mean to press back. So types of pain and sensations, there's tons. And if yours is not listed on here, or even if it is, let me know in the chat box. But there's lots of different types of pain and different types of sensations. As Samantha just said, phantom pain, that's not on this list. But these are some of the most common types of pain and sensations that are associated with multiple sclerosis. Now, again, they can also be associated with orthopedic conditions. For example, the first four, burning, pins and needles, numbness, and tingling, that can directly be caused from MS, but it can also directly be caused from a pinched nerve in the back, or really tight glute muscles that are so tight that they're pinching a nerve. So those are more orthopedic conditions. So some of these occur in more than just MS. You might have had sciatica, or someone that you know has had sciatica. That often feels like pins and needles or numbness and tingling down their leg, even though they don't have MS. But with MS, these are some of the most common ones. So burning, pins and needles, numbness, tingling, bugs crawling is something that I hear from a lot of my patients. Tightness, electric shock, stabbing, shooting, or radiating. I love the one that Samantha just said, which was phantom pains. That definitely counts. Let me see if you guys are saying anything else. Elizabeth, tightness and squeezing. Yeah. And, sometimes and we'll get into this again when we touch on the treatment, but sometimes it's caused directly from MS, and other times it's caused from MS symptoms. So for example, with Elizabeth saying tightness and squeezing, that could be due to a form of spasticity. So that's going to be a different form of treatment, because we're going to treat the symptom that's causing it versus treating it directly as if MS, the disease process, was causing it. That'll make a bit more sense in a few slides. Okay, so I wanted to give you guys some definitions because I think it's just helpful to orient ourselves, and I think it's really powerful to be able to understand exactly what type of pain you have and you're experiencing. And again, some of these are treated different than others. I forgot who it was, but someone earlier mentioned that they have paresthesias, and so you'll see that's our second one right here. I see Kay from Ireland. My lower legs are always so cold, especially at night. Yeah, so even change in temperature can be a form of pain, or at least temperature misregulation. Chronic back pain, I worry it might be kidney disease instead of MS. Yeah, and that's the thing too. If you're ever unsure, it could, because, I keep talking about, is it orthopedic related? Is it MS related? If you're not sure, go to an in-person physical therapist, and they should be able to help pick apart the layers and differentiate for you. And if not, then a physical therapist could be your first stop. And then they might say, oh, you know what, you should probably go see an orthopedic specialist, or a DO, which is a doctor of, oh my gosh, I'm blanking on what it is. Oh my gosh, I'm blanking, but it's DO is the abbreviation for this professional. So they can help you figure it out, because there's lots of reasons for pain when it comes to more orthopedic stuff. It could also be internal, as Kanita's saying, maybe it's related to kidneys. What's the difference between MS and MS symptoms? That's a great question. So I mentioned that that symptoms can be osteopathy. Yes, thank you, DO, doctor of osteopathy. So I'm going to stop sharing my screen for a second here, just so you guys can see me a little bit bigger. Okay, so I had mentioned that your pain, in this case, that's what we're talking about, might be caused from MS versus an MS symptom. So there is a difference. And the way that I like to think about it is, when I say something's caused from MS, what I mean by that is that it's misfiring signals. So your brain, and we'll get into this in a second because I have this on one of our slides, but basically your brain is misinterpreting something. You're feeling pain, but it's not actually there. It's just your neural pathways are misinterpreting signals. That's more MS related versus MS symptom. So in the example that I gave was MS spasticity. So if your MS, also due to neural pathways, not necessarily misfiring, but your neural pathways are causing muscles to be tight and spastic. That spasticity is an MS symptom, and tight and spastic muscles can then cause numbness and tingling and burning and pins and needles. So the reason it's important to differentiate, is it truly just MS versus MS symptoms? And again, it might be both, but the reason it's important to differentiate is because they're treated differently. If it's MS, it'll be typically more medicinal medication, and we'll get into that in a second. But if it's more an MS symptom like spasticity, we treat the spasticity first. If that doesn't help, then we might go over to this side and say, okay, let's also add a medication, or let's also add XYZ. But it's important to differentiate the two, because the medication that you get for pain might not touch spasticity. And so the medication might not help at all, because what's actually causing it is this spasticity. So it might just be because I love brainstorming and I like getting to the root cause of things, but it is really important to figure out why. And let me also say, this is not your job. It is not your job to figure out, well, what is causing my pain? Is it MS, like the neural pathways misfiring, or is it spasticity, or is it my weakness, or is it tight muscles, or is it XYZ? That I don't think that's your job to know. That's why you'd go see an in-person PT, why you'd see your neurologist, ideally someone who's willing to do this brainstorming process with you. But really great question. Kanita, what about MS hug? Yeah, MS hug absolutely is considered a form of pain. I'm gonna, where did my slide go? I'm gonna add MS hug and phantom pain to that list. So how can one tell the difference when it occurs? Yeah, so usually the way that you can tell the difference is going with the least aggressive route first, which in my opinion usually is not the medication route. So let's just say you have tight muscles. Maybe they're spastic, maybe they're not. We've had a whole different presentation on spasticity, so definitely refer back to that one if you can. But let's just say you have tight muscles. Maybe they're spastic, maybe they're not, and you're having pain. We don't know, is it MS? Or is it the tight muscles, or is it both? And so typically what we would do if I was working with you is we would develop a treatment plan with stretches for the specific muscles that are tight that might be causing the pain in the areas that you're having pain. And you would do that. You'd stay consistent at that treatment plan in PT and at home for, let's say probably anywhere from 3 to 6 weeks probably. And then we'd analyze, okay, is there any change in your pain? And usually if it is that, you would notice an improvement by the 3-week mark, but I like to always just extend it a bit further because some people won't notice improvements right away. But If not, we can change either the stretching exercises that you're doing, the duration that you're holding them, or how frequently you're doing them. So it's a lot of trial and error, but we're basically trying to see, does loosening those muscles help your pain at all? And maybe we start incorporating massage and muscle rolling techniques and a bunch of other things, not just stretching. Does any of that help? If yes, it's probably more of the tightness that's causing your pain. If not, it might be a combination of both MS and the spasticity or muscle tightness, or it doesn't really have anything to do with the muscle tightness. It really is just from MS. So it's a lot of trial and error trying to figure it out. So many good questions. Still new to my diagnosis. Yep, this all makes sense. Good, awesome. Would it be best to see an immunologist while seeing a neurologist? Sure, I don't see why not. I guess it depends what your goals are and what answers you're looking for. An immunologist would not help with this type of stuff. I'll say that. I haven't met a PT like you. Who cares? The ones here don't pay attention. Oh, I'm sorry to hear that. Oh, that breaks my heart. So I just added, to this slide here, the types of pain. I added the MS hug. That's definitely a type of pain and or sensation. I will say that one typically stems from spasticity. There are neurologists that basically say the MS hug is spasticity just in this specific area of your chest and your torso. But then there's others that say spasticity is just a factor. It's not the whole thing. And then I added Samantha's phantom pain. I like that one. Okay. So allodynia, this is the first type of pain that I wanted to mention. So this is where something like a light touch feels painful, even though it shouldn't cause pain. So if we were standing next to each other and maybe I just put my hand on your back to rub your back, or we're walking next to each other and I just brushed past you and lightly touched your skin, or someone tries to hold your hand or just touches your hand, these light touch things that feel painful and they shouldn't be. That's called allodynia. Paresthesia, this is a really common one. And sometimes paresthesia is like an umbrella term that, I don't know, umbrella as if it was over me. Paresthesia is an umbrella term where if you have any type of numbness, tingling, burning, pins and needles, people will just say it's paresthesia, even though it might be a different type. But anyways, paresthesia is usually an annoying, unusual sensation, again, like tingling or numbness. It might be triggered by something like muscle tightness or an injury, or it can just happen spontaneously. Dysesthesia is a more intense and sometimes painful feeling, which happens spontaneously. Neuralgia is intermittent shock-like pain, and it often follows a nerve path. And one thing that you might be familiar with, or you might have heard of, is trigeminal neuralgia. The trigeminal nerve is one of our cranial nerves, the nerves from our brain, and it runs in our jaw and down our spine. And so when you have trigeminal neuralgia, you will feel a shock-like pain. You could feel shock-like pain in your face and or going down your spine. If it was a different nerve, you would feel this shock-like pain in that neural pathway. Maybe it's down your arm or your leg. But so that's more of the neuralgia when it's a shock-like pain, and it's off and on. Usually it does go away after you change the position that you're in or enough time passes, or both. Optic neuritis, this is an eye pain that worsens with eye movement, and oftentimes people will say this feels like a dull ache behind the eye. Now, optic neuritis, sometimes it can worsen, or how do I want to phrase this? Optic neuritis will sometimes worsen with eye movement, but other times it'll just worsen just from you staring at something for too long. Like let's say you're experiencing optic neuritis, it might worsen just from looking at me for this hour or so long that we're going to be chatting together. So a little bit different approach there. Muscle spasm or spasticity feels like muscle tightness that doesn't let go. So if it's just regular muscle tightness, that usually feels like it lets go. You can still move, you just feel tight while you're moving, whereas spasticity often feels like you are restricted, like you can't straighten your leg as you walk forward because something is preventing you from straightening your leg, or you can't bend your knee because something is preventing you from bending your knee. That's more spasticity. And then musculoskeletal pain. So this feels like muscle soreness and or an injury. This is the type of pain we all feel. We've felt when we were kids, anytime we fall, if we bump into the corner. I tend to run into a lot of doorways as I'm like, I misjudge doorways. And so I'll turn and I like bump into it. That's musculoskeletal pain. It does hurt, but it goes away really probably within 20 seconds or so. Excuse me. Stress does increase my spasticity in my legs. Absolutely. Stress will worsen any MS symptom. I'll just put that statement there. I'm spastic on my right side from my neck down to my ankles. I'm on baclofen with little relief. How do you find a specialized PT? I think that's what the question is. We can come back to that because I want to make sure we focus on the pain for today and get through all these slides. But first of all, we do have a Moving with MS presentation all about spasticity and treatment options, and if something doesn't work, what else to do. So definitely refer to that. I'll grab the link for you and I'll put it in the chat. And in terms of finding a specialized PT, very quickly, I'll just say the MS Society has care partners. So you can go to the National MS Society website and find a care partner. I'm specialized through the Consortium of Multiple Sclerosis Centers, the CMSC. So you could go there and see if you're able to find a professional there. And also the American Physical Therapy Association has a website where you can find a PT and you can put in a specialty there. So that could be another option for you. Feels like a toothache in the eye for optic neuritis. Yeah. And acute illness. Yep, acute illness can worsen this type of pain or any symptoms. Stress and illness of any kind. It could be a cold, it could be allergies, it could be COVID, it could be the flu, anything. It can worsen any symptom. So what is the pain that feels like the muscles are tightening and radiating around the skeleton and throbs in each joint? So that actually sounds like a combination of lots of different types of pain. The joint pain might be more arthritis based versus one of these types. The tightening might be more of this spasticity type. The radiating might be more, let me see if I can go back here, might be more of the paresthesia potentially. So it is possible to have multiple different types of pain. It's very rarely is just one of these. But again, knowing the difference and which ones you have can allow you to just be more educated and knowledgeable when you're discussing these with your doctors, with your physical therapist, your neurologist, your primary care physician, etc. Okay, so why? This is one of my favorite slides because I think it's so important to understand why is this happening. If we don't know why, we're just kind of throwing a bunch of darts at this dartboard and we're just kind of hoping they land on the bullseye that will help, but it's not actually going to. So if we understand why, we can have a more targeted approach to improving it. So why are these MS specific? Not necessarily the orthopedic stuff that we've talked about for a bit here, but why are the MS specific symptoms happening? MS specific pain symptoms happening. So the reason is because there's damage to the spinal cord, which we know that that's part of what multiple sclerosis is, the brain, the central nervous system. So brain, optic nerve, or spinal cord. So there's the pain is caused by that damage that's in the spinal cord. And the brain can't interpret the sensation that you're feeling. So it tries to relate it to something you've already felt or know how it feels. So we've all probably, at some point in our life, stepped on something sharp. and it hurt really bad, or we've felt numbness at some point in our life, or we've felt stabbing pain at some point in our life, likely related to more orthopedic things, but we've felt that. So our brain understands what sharpness feels like, what numbness feels like, what stabbing feels like. And when you have MS, again, there's a misinterpretation, as I mentioned a little bit earlier, of the sensation that you're feeling. And so let's go back to allodynia, where it's just something light touches you and it causes pain. There's a misinterpretation. I may have just lightly touched your hand, but the sensation that you felt is not interpreted by your brain as a light sensation. It might feel like a stabbing pain or like a shock-like pain, because your brain and the neural pathways did not understand that it was light touch. It felt something happen, it didn't know what, and it fired red flags everywhere and said, ouch, that felt sharp, or that felt XYZ. So it wasn't an accurate interpretation, this misfiring, misinterpretation of the neural pathways between what's actually happening and what your brain is perceiving to happen. So it's this what's the word I'm looking for? Miscommunication in the brain between those two things. So typically, there is no actual damage to the part of your body that you're feeling the sensory change. So this is true for like the light touch, the numbness and tingling, any of the things that we've talked about when it's specifically related to MS and the misinterpretation, the miscommunication. Not if it's related to spasticity or a fall or something else, but if it's just related to MS and the misfiring and misinterpretation of the brain, typically there's no actual damage to what you're actually feeling. It just feels that way. So the body, or the damage, is in the nerve that is reporting to your brain, versus the damage is in your knee, which is where you're feeling the pain. So I hope let me know if that makes sense. Let me look over in the chat. There's a few things here. Was diagnosed with MS first, then fibromyalgia. Yeah, so it's very possible to have multiple diagnoses, MS being one, fibromyalgia being another. I have a few patients that I work with that have both. Please give links in chat to locating an MS specialist you named. Oh, you named several. Okay, I don't want to waste time right now doing that because we still have more to go through, but that is, remind me at the end and then I can type those in because I don't have them on me right now. I'd have to go grab them. Lori, here's one of the exercises for spasticity videos you made. Oh, awesome, thank you. Let me grab that. Okay. Kanita, rheumatoid arthritis, also autoimmune, so likely more with MS. So rheumatoid arthritis is autoimmune, but it's a completely different mechanism of injury, if you will, or mechanism of illness than MS. Steroid infusions did cause damage to my spine. It does make sense, makes sense, makes sense, makes sense. Awesome. Okay, good. It can be tricky to understand, and so I just wanted to make sure that I explained it in a way where it did make sense to you. Okay. So implications, and so of course the pain and sensory changes are annoying enough for you, especially because you're the one feeling it. So it's not ideal, but it also has implications in other areas of our life. And so one of them is if it's in your feet, if you have pain in your feet, numbness, tingling, burning, pins and needles, hypersensitivity or hyposensitivity in your feet, that almost always affects your walking. And so we need to take some strategies, and we're about to get into the treatment part, but we need to take some strategies to improve the numbness in your feet or the tingling in your feet so that you can feel the ground more and walk better. If you're experiencing the MS hug, someone earlier mentioned the MS hug, this can sometimes cause difficulty breathing, which obviously is not a very comfortable sensation, comfortable experience. So we need to approach the MS hug by doing some strategies like some stretching or some movement in that area to see if we can help reduce it so that you can breathe better. Pins and needles in your hands. So if you have any type of hand sensory or pain changes, oftentimes that results in more weakness and dropping things more. So if I have my big water bottle right here, if I can't feel it, I might not squeeze it hard enough because I can't perceive how much weight this has. So I might just lightly hold on and it falls through. So it might be weakness related, or it might have nothing to do with weakness and everything to do with the fact that I don't have as much sensation in my hand. So I just keep dropping things. Hot and cold. If you have difficulty sensing hot or cold, that often can lead to burns. If you have a heating pack on, or even an ice pack, if you leave it on too long in one spot, that can lead to burns of both kinds, cold and hot. Okay, so medication. So these are going to be the medications specifically for pain relief in from the MS side of things. So again, we're focusing on the MS piece here, not necessarily the orthopedic or even the MS symptoms causing it. But so typically for pain, these are going to be the medications that you might receive. Now there are some in here that do overlap with spasticity, and so you might know if you're on baclofen, so a lot of people are, baclofen reduces spasticity. And it can also reduce pain, especially if your pain is related to spasticity. And so some of these, Botox is another one. Botox can be injected into a specific muscle and or muscle group to release tension, release tightness. And so if the pain that you're having is caused from that and caused from misfiring pathways, misinterpretation of the pathways, then Botox might be something that can help. So Botox and baclofen, pulsed magnetic field, gabapentin, amitriptyline, duloxetine, pregabalin, and antidepressants. Remember back in the beginning, I said that anxiety and depression can worsen pain. That's sometimes why antidepressants are actually offered, is because if we can relieve some of the depression, relieve some of the anxiety, then ideally we would also relieve some of the pain that we're feeling. And so that's why it's so important, if you can, to work with doctors, neurologists, PTs who are willing to ask you these questions to figure out what makes it worse. What are your triggers? And we'll get to that in a bit too. There are no medications to relieve numbness. Now, sometimes gabapentin, which is this one right here, sometimes gabapentin is offered to relieve some type of tingling, burning, pins and needles, so it can help with some sensory changes. But typically, when we're talking about numbness, there's no medications for that. There is something else we can do, but there's no medications. Go to the next slide. So treatments. So of course it could include medication and some of these other treatments, or your doctors might decide, let's try some of these treatments first before we move on to a medication, especially if you're taking at least one, if not multiple other medications. So when we're looking at a more conservative approach, non-medicinal approach, these are the types of treatments that we would do. So occupational therapy is amazing. Typically, occupational therapy works with more upper body related things. So if you have pain in your neck, your shoulders, your elbows, your wrist, your fingers, your arms, occupational therapy usually is the first place that you would go. Physical therapy also helps with those things as well, but that's really where OTs specialize. And they'll give you exercises for it, but also splinting is something they specialize in. I would say, I don't know if specialize is the right word, but they know a lot about splinting. And so if let's just say you have pain in your hand and your hand kind of curls like this, but the pain is less when your hand is more open, they might make a splint for you that allows you to keep your hand more open, and that reduces the pain. And maybe they would do that in addition to exercises. So occupational therapy might be someone that you would see. Physical therapy, like myself, of course, things that we would do here, and this would be more so, it could be upper body for sure. I work on upper body with a lot of my patients, but it's primarily lower body, yeah, you could say. So hips, knees, ankles, feet, legs, core, front side, back side, either side, inside, outside, anything really core or lower. And so we could do some exercises like strengthening, we could do stretching, we could do electrical stimulation. And on the previous slide, I mentioned that there is nothing for numbness. There's no medications for numbness. But one thing that works really well for numbness, and if you're a Missing Link member, I know we have a few on here, then you'll know this. This is in the Missing Link. We do some desensitization exercises, which basically means desensitize. So you're doing some sensory exercises to lessen the impact of that numbness that you're feeling. So I'm going to just really boil this down into one instead of explaining the whole thing. It could take a while. But basically what you do is you'd find something. I happen to have this hair tie sitting here. You find something that might provoke your numbness. And so maybe it's something really soft, or maybe it's, I have a pen here. If I were to close the pen, this is a little bit rough on the edge. So maybe roughness would provoke it a bit, or maybe this sensation, it's kind of like a, I don't know, plastic sensation. Find a sensation that provokes it a bit. And let's just say it's on my hand. It could be your feet though. You would grab the thing that provokes it and just start touching it. And ideally it'll feel uncomfortable. It would feel abnormal. It would cause your symptoms to come on. But the longer you hold it here, the longer you do this, theoretically and typically it would start to lessen. And so one example I give all the time, I was working with one of my patients with MS who came in to PT one day, and she was in so much pain in her legs, and it was exacerbated by some stress that she was experiencing. But she was in so much pain that we couldn't do her normal PT exercises. So what I did was I got 2 buckets and we put a bunch of dried rice in them. She put her feet in, 1 foot in each bucket. And for about 10 minutes or so, I had her just move her feet around, pick the dried rice up, put with her toes, put it down, roll her feet, move all over. And after about 10 minutes, she said, wow, my pain is starting to go away. It's starting to lessen. And this included numbness as well. So her pain and numbness started to lessen. So we just kept doing it. So she did it for a further 10 minutes, so 20 minutes total. And the pain started lessening further up her leg. So when she first came in, she had pain from I think it was her knees down on both sides. After 10 minutes, her feet felt fine, but she was still feeling it in her calf muscles. After 20 minutes, she was still feeling it a little bit, but so much better in her calf, below her knees, including the calves and the feet. And so we're desensitizing, we're making that area sensitive by provoking it with something, in this case, my hair tie, in that case, dried rice. And the way that it works is by continuously keeping it there. What used to be seen as a red flag in your brain saying, whoa, this is uncomfortable, I don't like this, please stop. This is not good, not good. We keep doing it anyways. And typically what happens is your brain says, oh, okay, this isn't that bad. This is okay. Sorry for freaking out. We're fine. So that's basically the messages that our brain is receiving with desensitization exercises. Okay. Now, of course, exercise is a treatment that we could do, massage, hot and cold therapy, as I mentioned, electrical stimulation. There's lots of different types of treatment. Now, another thing that we need to focus on for treatments, again, going back to one thing I said earlier, which is that stress and anxiety can increase and provoke and worsen symptoms. We got to focus on the stress and anxiety. There's so much stress that can happen in multiple sclerosis, even on an underlying level where you don't even think you're stressed, but you are slightly and it's causing your symptoms to worsen. Or you might not even realize that your body is in fight or flight mode, but just because of having MS, your body is in more fight or flight than someone without MS. So what can we do to reduce that stress, reduce anxiety, reduce depression? So that's going to look different for everyone. It could be meditation, it could be coloring in a coloring book, but we want to do something to reduce that stress. resting. Sometimes it just requires not exercising, not doing anything, just allowing your body to rest. Distraction or focus elsewhere. So if you're feeling a lot of pain, let's just say in one of your legs or one of your feet, sometimes it can lessen just simply by distracting yourself, by focusing on something else. And you could be focusing on something like a hobby. Maybe you're writing something down or you're typing an email, like you're focusing on something else. Or it could be that you're exercising your upper body. So there's lots of different ways to distract yourself, but that's a really good way to reduce pain elsewhere. Focus on steady breathing, specifically belly breathing. Belly breathing is a type of breathing that calms our nervous system. And so belly breathing is when you inhale through your nose, your belly comes out. And then when you exhale through pursed lips, through your mouth, your belly comes in. And if you've never breathed like that before, I feel like we should maybe even do a full webinar one day on belly breathing. But if you've never done that before, it feels very counterintuitive, very wrong, very off, because for how many years when you breathe in, your chest comes up instead of your belly going out. So learning how to belly breathe will specifically activate the vagus nerve, calm our nervous system down, reduce that stress, reduce anxieties, and ideally reduce pain. So we're almost at the end here. So if you do have any further questions, please feel free to put them in the chat. But what can you do? So, there's so much that I mentioned in here, and then I mentioned afterwards, you shouldn't be the one to figure this out. This is not your role. You are a professional and the best person to know what's happening in your body, but you're not the person who went to physical therapy school or neurology school. It's not your job to figure out the why behind these things, but it's really important that you work with professionals that do. And one thing that is extremely helpful is to let the professional know any detailed information that they can, instead of just saying, I have pain in my foot, I have pain in my hand, or I have pain XYZ. You could now use one of the definitions that we've learned. You have paresthesia in your foot, or you have allodynia in your hand, you have XYZ in XYZ. Not only that, what triggers you, if anything? If nothing triggers it, it's more likely specifically related to MS. But if something does trigger it, it might be more related to one of the symptoms, or maybe orthopedic, or a combination of both sides. So does the heat make it worse? Someone earlier mentioned if it's cold, their spasticity worsens, their pain worsens. Does the cold make anything worse? Does stress, when you're stressed, we're approaching the holiday season, we're in the holiday season actually. Are you stressed? Do you still have gifts to buy for people and you don't know what to get them? Does thinking about that make your pain worse? Does exercise make it worse? Sexual issues, things that you use, chairs you sit in, what are triggers that make it better or worse? Not just worse, but does anything help or make it worse? Those are really important things that you can navigate on your own and then share with the professionals so that we can better figure it out. Okay. So those are all the slides I wanted to share with you. I do see a few questions coming in. So we'll do that. For anyone who maybe doesn't know me, especially if this is your first time, this is always the last slide that I share. If you have any questions, you can always reach me at my email, hello@drgretchenhawley.com. If you're ever interested in working with me or seeing what types of services I offer, you can go to missinglink.com. I do have a Facebook group, Instagram, podcast, YouTube. The Missing Link is my online MS wellness program, and I have an app and a book. There's way too many things to put on here. The book is the newest. It launched in July, and I'm actually releasing an audiobook in January, which is exciting. But these are all the places that you can find me if you just like what you heard, want to get more tips and education and whatnot. Okay, let me stop sharing my slides and see what questions you guys have. Okay. Lori says, I was so ready to sign up for your Missing Link for 4 weeks. Broke my foot though. No, but it's getting better now. Awesome. That's good. diaphragmatic breathing, box breathing. There's lots of different types of breathing. For some people, what I would call belly breathing is also called diaphragmatic breathing. For some people, it provokes anxiety. It's like it's too much to focus on, too much to coordinate, and it doesn't feel great. There's box breathing. There's a breathing, I don't know what this one is called, but you just trace your fingers and you inhale on the way up and exhale on the way down. And then you inhale. So you just go really slow for both the inhale and the exhale. There's others where I think you breathe in for 4 seconds, hold for 5 seconds, breathe out for 6 seconds. So there's so many different types of breathing, nostril breathing, box breathing, there's a bunch. So if you don't like the belly breathing, there's other things that you can try. Would like to learn how to belly breathe. Yeah, so for belly breathing, again, now that I'm bigger for you guys, I'll do a quick demo. So I always just have to make sure my dog's not behind me. So what you're gonna do is you're gonna put your hands on your belly, and as you inhale through your nose, your belly comes out. As you exhale, your belly comes in. So it looks like this. I'll show you from the side a little bit. And so again, if you haven't done that before, that's probably going to feel very confusing. I was just doing this with one of my patients over the weekend, and she had no idea what I was talking about. And I said, still do it. Even though you can't understand it right now, you can't put what your brain understands to what is actually happening physically, still try it. The best way to get it is to just keep practicing and keep in mind exactly what's supposed to be happening. And typically, eventually you will get it. Why does sunlight sometimes seem to burn my skin? Sunlight is interesting. I don't know exactly why that happens to you. I feel like I'd need to know a lot more information, but I will say I have a patient with MS who heat doesn't bother her, but sunlight does. She can be outside on a hot day, like a hot, gloomy day, and totally fine. But if sunlight touches her, it worsens her symptoms. And so she has lots of windows in her home. So it could be winter time and she's actually a little bit chilly, but the sunlight is coming in on her legs and her legs feel a lot weaker. So sunlight is really interesting for some people. Compression wear has helped me. Awesome. Yeah. Compression sleeves for the feet, compression sleeves for the calves. Yeah, that's a really good point. Let me add that to this list up here, compression. Let's see. I love your book. Can't wait for the audiobook. Yay, I'm so glad. Please show this slide again about how to reduce stress. Okay, let me find that one. I'll pull that up. This was the slide for reducing stress. Belly breathing. Pam says belly breathing is so cute, pregnant. Yes. So for those who don't know, I'm 6.5 months pregnant. And I will say it does make demonstrating belly breathing easier because I have a bigger belly now. So you can really see the difference when I'm breathing in and it comes out, and then when I exhale and it goes in. That's such a funny observation. Yes, what time we got here? 7:53. So I did want to, someone did ask earlier, I'll keep this slide up just for, I think it was Michelle who wanted that, but I'm going to type in the chat box so you guys can get it. I don't have the links on me right now, and I feel like it might take a little bit too long to grab them, but the places you can find an MS specialist are Consortium of Multiple Sclerosis Centers, National MS Society Care Partners, and the APTA, which is the American Physical Therapy Association. I think they have on their website, they have a button right up top. You'll see it if you go there. I think it's called Find a PT. Okay, so I just sent that message to everyone. Hopefully you guys all got that. Peggy says, congratulations. Sure enjoyed all your classes and teachings. Awesome, Peggy. Oh, this is what I wanted to share. I have a YouTube video. Someone, I forgot, was it Lori or someone shared with me privately, and I forgot to share it with you guys. This is a YouTube video that I'm going to share with you guys. That is a video that I posted on YouTube about reducing MS spasticity through a couple of different types of techniques. So that will hopefully be helpful for anyone who mentioned spasticity, because I know a few of you guys did. All right, well, I will leave it at that for now. Thank you so much for tuning in. I'll see you guys next month. Happy holidays, Happy New Year, and I will see you in January. Bye, everyone.